And you may have noticed more men with mustaches this month. It's Movember. That's an annual event in November when men grow mustaches to raise awareness and funds for men's health issues. A particular focus is on prostate cancer, testicular cancer, and men's mental health. So today we have Dr. Bowren from Allina Health to discuss these important topics. Thanks so much for joining us, Doctor.
Yeah, thanks. It's great to be here.
So let's start with this. The motivation behind this movement in November.
I think the thing is, what I like about Movember is that when it comes to personal health, men and women tend to deal with it differently. Women are proactive. If they don't feel right, they start thinking about their symptoms. They start reading about their symptoms. If they don't figure it out, they talk to some friends. If they don't figure it out, they do this crazy thing. They make an appointment.
We don't do that. Why don't men? We don't do that.
Well, that's the opposite of that is men who tend to be conactive about our health. So by conactive, I mean we tend to think of reasons why we don't need to look into this, why we don't need to go to the doctor. We say things like, well, I'm fine, and so it's going to be fine, and it'll continue to be fine, which, of course, doesn't reassure any of our loved ones. And the other example I'd say is, like, how many male friends do you know who know more about their fantasy football league than they do about their personal health?
100%.
They can go
100%, yes.
Endless detail about these draft choices, stuff like that. And if you ask them, what is cholesterol?
I'm sorry, what? What was that?
One of the neat things I think about Movember is that it does encourage to have these discussions that sometimes people don't want to talk about. Why don't you talk about that now? Like, what are some of the signs and symptoms of prostate or testicular cancer?
So for prostate cancer, really there are no symptoms unless you developed advanced disease, where it's actually blocking the draining of urine, or you're getting pain in your bones. So that's why the only thing we really have to detect it is with a PSA test, which is a blood test. Sometimes a very common symptom for older men is to have urinary urgency or having to get up at night and pee. That, and oftentimes men worry that is a sign of prostate cancer, but that involves the inner part of the prostate, where cancer tends to be on the outside. So that typically isn't a symptom of it. So again, no common symptoms. That's why you need a PSA.
And that's why you need to go to the doctor for your regular checkups.
You can't get that at Walgreens, so you got to go to your doctors.
So I know you've got a book, and you've got a chapter that focuses a lot on, well, a book on health, on men's health, but it focuses on mental health. A chapter focuses on mental health. More men, it feels like, at least in my circles, and I'm noticing, are talking more about mental health, which is good.
Yeah. So I would call myself a pre-geezer. I'm 60, or just about there. And I grew up. This chapter that I have on mental health kind of starts out very autobiographically, and I tell my own story not because it's spectacular, but because it's very average. And that is, I grew up in an emotional mental health vacuum. You know, I had a very blue collar, great parents, but there was just, whether it was at home or at school or at church, there was nothing about helping us with our mental health, even getting an emotional IQ or finding the words. And when you watch as a kid, you know, the people I was supposed to emulate as a young male were actors and athletes. So people who were steely resolved,
strong,
who kept it all in. What proved their strength is that they kept it all inside. And none of those things that doesn't work. And so what I love about this resurgence of people that are well-known celebrities coming out and saying, like, you know, I have depression. You know, it begins the conversation, and even like in Ted Lasso. Here's Ted Lasso. He's the highlight of the show,
and it turns out that he was dealing with it.
You know, he's still the highlight of the show, but he's wounded. He has these panic attacks.
You're right. I like that. It's like, it's not because it's spectacular, but because it's normal.
Yep.
All right.
Connects us all.
Doctor, thank you so much for coming in.